Welcome to this month's Fit for Colorado Talk to the Doc Chat. I'm CBS 4 anchor and health reporter Kathy Walsh. For the next half hour, we'll be chatting about health issues here on CBS4Denver.com. Throughout this chat, we encourage you to ask questions by simply typing them in the chat window at right, and we will do our best to answer those questions. In today's chat, we're going to discuss foot health. Don't take your feet for granted. Guess what? 3 out of 4 Americans will experience serious foot problems in their lifetime. The foot contains 26 bones, 33 joints, 107 ligaments, and 19 muscles. When the bones in the foot are out of alignment, so is the rest of the body. Joining me today is Dr. J. Cade Christensen, podiatrist at Presbyterian St. Luke's Medical Center. All right. When do people start experiencing foot problems? We know a lot of people get them. When does it really start up?
It can vary. A lot of people, it depends on the type of problem. We've seen there's certain problems that are manifest more in children, and then there's other things that are kind of a wear and tear that tend to affect people later on in life. But foot problems can start early.
Yeah.
They really can.
You have to be conscious of that. I don't think people think about kids and foot problems. When should you take your kid to a podiatrist?
Well, your kid's normally going to tell you. If they're young and they can't, you need to watch their walking patterns. There's certain things that, the way they walk, if they complain they want to be carried all the time when other kids their age, are walking or are more active, that's some of the first signs that a parent may see. And then obviously as they're older and they can tell you, hey, something's not quite right, or they're complaining or rubbing their feet, then it's worth having it looked at.
When people complain, we hear about a lot of things a lot of the time. Let's go over a couple of those. The one I hear a lot is bunions. Let's take a look first of all. I know we have sort of a graphic where you can explain what is a bunion.
So what a bunion is, and there's a lot of misconceptions out there about actually what a bunion is, but a bunion is actually a joint that's not lined up well. So it's the first metatarsal phalangeal joint, and what happens is over time there's a musculoskeletal or tendon imbalance that causes the big toe to kind of drift towards the smaller toes, and then people will notice a large bump on the inside of their foot. Bunion in Latin actually means turnip. So what happened is people would wear shoes and they look down and they see a big red, a bump on their foot. And so
you got a turnip. Oh no, it's a bunion.
It's a bunion. Mm-hmm. So exactly. So it's actually a joint that's not lined up. People kind of confuse them with warts or corns or calluses, but a bunion is actually a joint that's not lined up correctly.
It can be pretty painful, can't it?
It can initially, and over time, it's kind of like tires on your car. If the joints in your feet aren't lined up correctly, they wear differently. So oftentimes a malaligned joint will, cause arthritis in the future.
Is it hereditary?
There's definitely a hereditary component to bunions.
What else can cause it?
Trauma. If you whack your foot really good, or if you do something like that, that can kind of get that balancing off, the alignment off a little bit. But typically we do see it more as a hereditary type thing. So we always tell patients, look at mom's feet, look at grandma's feet, and maybe you can kind of see what's coming down the pike.
So what do you do about it?
Bunions, initially you try conservative care, the type of shoes you wear, orthotics, certain things like that. Try to find those things that don't irritate the bunion. If the bunion progresses and it gets on down the road a while, typically bunions do end up being surgical problems. A lot of the braces or things you see in magazines to try to keep your toes straight just don't usually cut it.
So what would you do in surgery? Do you have to shave it off, or what
you do. You kind of shave off a portion of the hypertrophic or extra bone, and then what you do is you actually realign that joint and you try to get that joint lined up correctly again.
You've got a foot model here. Can you show us basically what you would do in surgery?
I do. So this is actually here is the first metatarsal phalangeal joint, and what you'll notice is with the bunion is the toe, the big toe kind of tends to gravitate towards the smaller toes. This retrograde pressure actually pushes this first metatarsal out further. This irritation kind of causes this bone to enlarge, and so the bunion is actually kind of right here. You can also have a bunion on the top, which you'll see some extra bone, or people will call them bone spurs, and you'll see that as well. So typically what we do is we shave off the additional or excess bone in there, make a cut through the bone, and actually realign it and slide it over. This one's actually fairly lined up because this is a normal foot. However, typically with a couple small screws, we can usually keep that joint lined up and then functioning properly rather than skewed.
And then you take, what, a couple weeks recovery, and then you should have some relief, huh?
Typically, it depends. There's different type of procedures depending on the severity of the bunion. Most bunions, you can walk the same day of surgery, which is surprising to a lot of people. Bunion surgery's kind of come a long way.
No kidding, that's great. Well, let me talk about something else that I hear a lot about and that I remember growing up hearing about in my family, hammer toe. I used to laugh and say, what is that? Let's take a look. Explain that one, if you will.
Okay, so that's kind of a quick little graphic of what a hammer toe looks like. So a hammer toe is typically the lesser digits that kind of slowly contract and elevate. Your toes still like to purchase or touch the ground, and so over time you'll get a curvature of the toes. Initially those are reducible and you can kind of straighten the toes, but over time, again, because of the tendon imbalance, the toes will kind of become contracted and stay elevated. They can obviously cause issue in shoe gear if your toes are sticking up. A lot of shoes don't have a high enough toe box. Some of the more fashionable shoes, I guess, don't have a high enough toe box, and you kind of run out of room in the shoe. The most common cause of hammer toes usually is a bunion. Again, it's a biomechanical type thing. If the first ray or the bunion's not pulling its weight, the weight gets transferred to the next one in line, so the second toe is usually the most commonly affected.
All right, let's look at plantar fasciitis. Boy, did I suffer from that, and for a long time. And I hear so many people say to me, I have this horrible heel pain. What is it? I say, I think I know. Explain that one for us, please.
So plantar fasciitis, the plantar fascia is actually kind of a thick, I describe it as a rubber band that kind of runs along the bottom of your foot. It inserts in your heel bone, as you can see on the graphic, and goes up to the ball of the foot, or the metatarsal heads. So what happens is, at night, your foot's typically nice and relaxed, and so you go to step down in the morning and that foot collapses and it puts pressure on that fascia that spans the bottom of the foot. So the weakest point of that fascia is usually where it inserts into the heel bone. So people will complain of waking up in the morning and just having pretty severe heel pain, thinking that they had somehow bruised their heel or couldn't quite figure out what happened. Typically that is inflammation of the fascia. You can get small tears in the fascia itself,